Welcome to Your County on Community 7 Television. I'm Shoots Veis and I'm your host. Each month we dive into a different aspect of what's going on in Yellowstone County. And this month we're very excited to have Casey Williams on. Casey is the Director of Disaster and Emergency Services here in Yellowstone County, and he's been pretty busy over the last year. So we're going to dive into all of that with him. Casey, thanks so much for coming on the show with us.
Thanks, I appreciate having you.
You bet. We're going to dive into pandemic, and I know how, that's kind of consumed everyone's world for now. But before that, let's lay the groundwork a little bit about what is disaster and emergency services, and let's start here.
Okay.
Why does Yellowstone County, why do we have a disaster and emergency services? Why is it Yellowstone County's role to have a disaster and emergency services department?
Well, it starts at the federal level, and through presidential directives like Presidential Directive number 8, which talks about the national preparedness. Presidential Directive PPD 21 talks about critical infrastructure protection, the formation of FEMA, all that history.
Yeah.
Says that each state is going to have an emergency management function and department within the state, and then each state has delegated that. And I think Montana Code 103101 or 103100, one of those, designates through the Department of the Military that each county will have that. So from a legal standpoint, you have to have one.
Right.
The reason they have it is to have that over 30,000 foot view over preparedness, planning, protection, mitigation, response, recovery. Those are the things that we look at for pretty much anything that could possibly go wrong. So our role is to protect Yellowstonian lives, property, and environment.
Sure. Yeah.
From anything we can think of that would happen. Now, obviously, you can't prevent everything from happening, but the overreaching goal is that, and to have that liaison between the local government, the state government, and the federal government through FEMA and all that stuff.
Yeah, yeah. So then talk to us a little bit about down here, kind of more at the local granular level. What does your department do to work with other departments within Yellowstone County, but also probably within City of Billings, City of Laurel, some of the other entities that are out there? I know we have a lot of rural fire districts as well. So how do you integrate with kind of those departments that normally we would think of, okay, it's a fire, it's kind of an emergency type of thing. How does your department integrate with some of those other departments that have a piece of it here or a piece of it there, or that type of deal?
So our department is the emergency management department for all of Yellowstone County. That includes Laurel, Billings, Broadview, and all the unincorporated areas. So we act as the DES office for all of those. Interacting with all of the public safety, we interact with them on a day-to-day basis based on what the response to a particular emergency is.
Sure.
We're all part of the overall emergency planning network for the county and all the incorporated areas. We have a very active and good LEPC, which is the Local Emergency Planning Commission, which we're required by law to have, but ours is very active, and it includes all of our public safety people or members of that. All of our emergency plans for the cities and the counties are all hazard focused, so it includes law enforcement and fire and EMS and the government, and so we interact really, almost daily with one or the other public safety organizations. We also maintain organizational, operational, and communication coordination between all of them. So if we have a multi-organization event, if something big happens that requires the police and the fire and the EMS, and they all need to talk to each other, or our state partners come in, we help provide support and resources, whether it's human resources or physical resources, to help with any event that we have in here.
All right. Give a sense for some of the emergencies or disasters that you're planning for on a pretty regular basis. What are the ones that, there's a reason it's called an emergency, right? Is because it wasn't planned for. But beyond that, I think you've been doing this long enough that, I know we didn't plan for this, but these are going to happen. So give us an idea of what are some of the things that you're planning for on a pretty regular basis.
So, as a community, we have developed a multi-hazard mitigation plan, which is, we've listed our top 30 things that we believe could happen.
Sure.
There's a lot of things like we're probably not going to have a tsunami
Right.
or a hurricane, so we're not going to throw the.
Yeah.
But we do list those, and some of the things that are on the top of those lists, some of the top 5 are disasters that are human-made, whether it's terrorism, civil unrest, cyber threats, threats to our communication system, the 911 system. Those are threats that we look at on a very regular basis to try to mitigate and minimize the impact of. Obviously, communicable diseases, as it turns out, that was one of the top 8. And sure enough, here we are. We've spent the last year dealing with a global pandemic. Fires, severe weather events, whether it's tornado, drought, massive winter storms, things like that.
Sure.
Those are some of the top things that you just landslides off the rims. Those are the things that we look at. Like, I wake up every morning and I'm like, okay, what could go wrong now? And I kind of go through those top ones. We have a huge hazardous material threat in our community. We have, believe it or not, we're at risk for agrarian problems, whether it's a crop disease or drought-related thing, or if we have a livestock communicable disease in the livestock industry. A large part of our economy is based on the agrarian, and so we also have to prepare for and think about, well, what happens to that industry if that happens, the hazmat. But those are probably the top 5 or 10 things that we do on a regular basis.
So how do you kind of weigh the likelihood of an event happening versus the potential it could have, i.e., let's use a tsunami as an example, because it's not going to happen here, right? But it's going to be a rare event, but if that rare event does occur, it's probably going to cause a lot of damage.
Right.
Versus, let's use a winter weather storm here, right? It can cause some damage, but we do live in Montana. A lot of us have grown up here, and we know it happens, and it can be a problem, but we know we're going to get through it as well. How do you kind of weigh those unlikely events, lots of damage, versus likely to happen, but this is just kind of something we deal with on a relatively regular basis?
Good question. So on a regular planning cycle, where we evaluate on a very regular basis our threats and hazards. Every year I complete a threat and hazard analysis of the community. So you look at the likelihood that something's going to happen, and I'll take fire.
Sure.
So we have a lot of fires. That's a regular occurrence. It's a real thing. And sometimes they're very big and they're very expensive. But in this part of the country, or the state, they don't damage a lot of the infrastructure.
Sure. Yeah.
Okay. So it's a very high likely event, but it doesn't cause a lot of infrastructure damage. It doesn't hugely negatively affect our economy, things like that. Civil unrest. So if we look at some of the things that happened over the last few years, let's say Portland, we'll just take. Not as likely to happen here, but would have a huge economic and social impact on that. So if we weigh those things and say, well, how prepared are we to respond to and recover from some of these major things that we've identified, and then you kind of rank them based on likelihood and impact.
Sure.
And there's actually a math formula that goes through and puts a number to that. And so we look at those disasters on a regular basis and try to prepare for not only the ones that are most likely to happen, but equally as important are those that might happen but have a huge economic impact or an impact on the human side of it. So we kind of do the fires and the ice jams and the potential for high wind events and hail with the same emphasis as we would a civil unrest, a massive cyber attack. Some of those things that we could experience that have a big impact, but not as often.
Sure. And I think probably that leads us into, why does your department worry about a pandemic type of situation? Well, we've just lived through the reason why. Yes. It's very rare, but its impact is very high when it does happen. So walk us through some of the places where we were a year ago, maybe even 18 months ago, when we're talking about okay, what would a pandemic look like in Yellowstone County?
So, even before I got here, that was part of the Unified Health Command. The Unified Health Command in Yellowstone County is the Disaster Emergency Services, Billings Clinic, St. Vincent, and Riverstone Health. And they talk about major health care issues, big communicable diseases. Before the pandemic hit, we were looking at measles because due to vaccination slowdown in measles is making a comeback. So we were talking about what if we had a localized major health event that overwhelmed our health. So you look at those things and we try to plan and try to put things in place on, okay, well, if we run out of capacity at a hospital, what do we do? Usually, those events are relatively localized. This happened to be global. So the plans that we had on, okay, if this happens here, we will get help from the unaffected communities. Well, as it turns out with COVID, there is no unaffected community. Everybody got pinged out. Fortunately, we have some really smart people at both of the hospitals in Riverstone, and we took the plans that we had in place for a localized event, scratched off the fact that we could get help from another relatively close, like Denver, say, and reworked it, got back together and said, okay, this is what we have. How are we going to deal with it? What are we going to do when the hospitals get overwhelmed? How are we going to staff? Those kind of things. And for the most part, here in Yellowstone County, it worked out. Not without some hiccups, not without some bumps. We definitely have learned a great deal of ways to deal with this, and I think going forward, heaven forbid we don't have another one. But if we ever did have a major health outbreak again that overwhelmed our hospitals like COVID, we're better set now to deal with it than we were 18 months ago.
Did you at all, as part of previous planning for the pandemic, or as do that, one of the things that's a bit unique about Billings and Yellowstone County is we are a regional medical facility. And so I'm assuming, I guess I don't know this for sure, but I'm assuming that those patients that they can't be treated in the outer line, they're coming here. And so was that part of that regional outbreak that you talked about, the measles one, and then how was the planning done to say, you know what, we're going to get hit worse with this because everyone's coming here because these are where the two big major hospitals are?
It is, and that's the regionalization of our healthcare system is always a consideration in the long-term planning and when we talk about this, so that never went away. It was always a part of the realization that we service, from a healthcare community, a population of around 600 to 650,000 individuals that covers several thousand square miles. I mean, we go out to Wyoming and the Dakotas and eastern part of Montana. So in all of the major healthcare outbreak plans, the training, that kind of stuff, it's always a consideration of, if this is a regional event, Yellowstone County and the city of the two hospitals that are located in the city of Billings, we're not just dealing with Yellowstonians. We're dealing with a much larger population, and that's always been part of the plan. And so that part really didn't come as a surprise to anything.
It seems like we're on the downhill slide of this, and everything's going in the right direction. Again, knock on wood with that. Given that, were there times during the last year where you were really concerned about the capacity of our medical facilities to handle this, and maybe we're going to have to move in some additional medical facilities into our community?
Yes, and we did. So we had a couple of options. So the state, working with the federal government and the state and the National Guard, purposefully built out an overflow hospital. We call it the alternate care hospital, but it's an overflow hospital. They put that footprint down at Metro Park in the Expo Center to increase hospital capacity. We built out 90 beds. That was repackaged up, and it's deployable, so it can go anywhere in the state. The hospitals have an overflow capacity plan, so each of them have a surge capacity plan themselves. And both hospitals did a fantastic job of being creative, and they exceeded their surge capacity plan, so they had to come up with additional stuff, and both Billings Clinic and St. Vincent and Riverstone did a real good job of maintaining that overflow creatively closer to the hospital, and for logistic reasons that works out better. If we set it up somewhere else, we have to bring in help to do it, and we still had to bring in help for the hospitals. But it was better that it could be contained closer and within the medical campus and that medical center. But we wound up with patients in areas where we haven't put patients before, and they were trying to give them care, and they got as good a quality of health care as you could. Both of the hospitals have done an excellent job of handling that overflow. We were at 115, 120% capacity for quite some time, and in November we had big spikes. Both the intensive care units were overflowed. Both hospitals were using alternate locations to take care of patients. We had to bring in additional staff. We had to bring in additional beds. We had to bring in additional life support equipment and other devices to help take care of all the patients. So.
I don't know if the answer to this is yes or no, and if it's no, it's no. But given that the DES's role in planning across the county, were you guys involved then in planning any of the vaccination piece of it that's going on now, or did that completely stay within the Unified Health Command?
So, a little bit of both. So as a county, we had a COVID incident management team for the overall county operations. Also, there's the Unified Health Command incident management team dealing. So the Health Command also includes the DES office. So as the DES office, I was the commander of the overarching and one of the two commanders for the Unified Health. So it was really kind of a homogeneous mix there, very involved in the planning. Now, my role, or the DES role in the vaccination clinic, is mainly supportive. As an example, this week we requested and got approved to get National Guard help to come down and do some of the non-clinical staffing, because they're on orders because of the pandemic. So we're going to have the good men and women of the Montana State National Guard helping us at both the clinic at Cedar Hall and the clinic that will start next week at the Shrine. So we'll have National Guard people helping us on both of those places. Today we talked about some additional resources that they need that I'm kind of helping coordinate and things like that. So,
Give us. I'd be remiss if I didn't ask now, but give us a quick. If you're out there and you're watching us and you want to get a vaccine, how do I go about getting that process started?
You go to Riverstone Health. There's a link on how the number to call or the website to put it in, so you can schedule an appointment online, or you can schedule an appointment over the telephone. And I apologize, I have forgotten that number today, so I can't tell you that. But the Riverstone Health, you can go there, schedule an appointment. That'll be your first appointment. When you get your vaccine, they will assist you in scheduling your second dose. Both of the Moderna and the Pfizer require, the vaccines we're getting now require 2 doses.
Sure.
The Pfizer vaccine, I think, is 21 days. The Moderna is like 28 days, but they will schedule that. We're going to do the first dose at Cedar Hall at Metra. The second dose will be at the Shrine building.
And so those guard people that are coming in are going to probably do some of the administrative pieces of that. Where do you go? Temperature check, ask some questions, type of thing like that. And then I guess beyond that, okay, who am I getting my shot from? Where are those folks coming from? Fill us in on some of those details as well.
All right. So right now, Riverstone Health, St. Vincent and Billings Clinic they have their clinical people, pharmacists and nurses and nurse practitioners that are delivering the shot, constituting the vaccination, doing all the medical stuff they have to do with the vaccine, delivering the shots. And it will continue to be healthcare professionals that deliver the shots and all that. If we can take the burden of staffing off of the hospitals and give them their nurses and stuff back to go to the hospital, and we can use nurses and pharmacists and techs from outside the area, FEMA will help us reimburse for those things. So we are looking at some solutions that give both of the hospitals back their nurses, but we still have licensed nurses and pharmacists and things running the clinic.
All right. So while all of this is going on, while there's a pandemic going on, doesn't mean other emergencies or disasters are taking place.
Correct.
Talk to us about some of the ones that have taken place over the course of the last year, and what is the impact of COVID protocols on fighting a fire or dealing with a different disaster and emergency services while that is going on?
Well, so we've had fires. We've provided also mutual aid. So our neighbors in Muscle County had a huge fire, the Bobcat Fire, which took up a lot of time. That was probably the most media reported disaster we had. We still have hazmat issues. We still have traffic. People still have fires and emergencies and car wrecks and everything else that goes on. COVID has had an impact on how we respond in the sense that in order to maintain safety for the EMS and fire and police, they still have to socially distance. We still have to make sure they have PPE. Our briefings, our responses are more separate. We still do it, but we have to follow the same safety protocols as anybody does to prevent the spread through the ranks. We also have it limits sometimes throughout the course of this year. We've had limited numbers of responders because they were either sick or they were quarantined because they were exposed. So we had some very lean times, whether it was the EMS, fire, police. We've had to really flex staffing in all of those organizations, and kudos to all of the chiefs of each of those organizations for being able to do that. Because there have been some times when we were very lean just due to the disease itself. So it's had a significant impact on our abilities.
When you, I'm assuming you're talking with probably some of the other DES folks across the state. What are you hearing that Yellowstone County is doing well? What do you hear from other places and say, boy, I wish we would have done that?
Well, funny, because we're all kind of in this together. And nobody alive has ever gone through a global pandemic.
Yep.
So I think collectively as a state, we've done some things well, done some things, and we're constantly communicating. But what we've wound up doing is acting like a fairly decent team. So it hasn't necessarily been, hey, Stillwater County, what did you do right? Hey, Yellowstone, what did you do right? It was get together and say, what can we do?
Yeah.
Yellowstone County's at an advantage because we have more capacity in our health department, more capacity in our hospitals. So we've been able to do some things that, due to our good fortune, that other counties haven't had the luxury of being able to do. We've had the misfortune also of being the medical referral center.
Yeah.
So if they can't handle it, let's say in Bighorn County,
They're coming here.
they come here and we handle it. Things that we've done, Montana is ranked, we're tied in first place for the most efficient use of vaccination, for example.
Sure.
And I know that at our vaccination clinic we're having now, we're running at almost 100%. We get the vaccine, we get it in the day that we say we're going to get it in. So that's setting those up. We've done a really good job. I think we did a really good job handling the November time period surge in the hospital capacity. I think we learned that we'll be more prepared next time. So we did, that was a challenge.
Yeah.
Never having done it before, that was a real challenge. And getting resources, that was a real challenge. Some things that we probably should do better that we've learned about is some of the internal processes, communications. I mean, you're dealing with multiple healthcare entities in this town.
Yep.
Whereas in other counties, there's a singular healthcare entity.
Mm-hmm.
So we've had to learn how to get Riverstone, a health department that stands alone, and two independent hospitals to do things together that perhaps they were prepared to do, but they've never really done.
Yeah.
So you have two different business models there with different computer systems, et cetera. Getting all that to work as one machine has been a development over the course of a year.
Sure. Okay, see, I think I could probably talk to you for 3 hours about the last year, and I'm sure within your career path, this is going to be a unique year that you're going to be able to look back on and say,
and throw darts at.
Yeah, and say, hey, this is why we plan for this stuff, even though it's a super unlikely event. When it does happen, it's a big deal. So, but we'll have to wrap it up. And I just want to say, on behalf of Yellowstone County and the Yellowstone County residents, thank you so much for what you and your staff do to coordinate all of this stuff, to put all of this together so that we can have a coordinated response. Thank you so much for all you do.
Well, I really appreciate it, and it's my pleasure and honor to live here and serve the community. And a shout out, you can't minimize the first responders, the hospital workers, the frontline people that have dedicated so much of their time and effort to making this more successful. And hopefully we'll continue on the right path. And as the weather gets better, we'll get back to a more conducive sense of normalcy where we get to go to a basketball game, or we get to go do some things that we haven't done over the course of a year. So thank you, Shoots.
You bet.
Mm-hmm.